The project is improving emergency wait times through the medical value stream. It's a process in which we look at the patient's journey from their arrival at the emergency department until they're discharged from the medical wards. We value stream map the process through value stream mapping exercises with the group, which lays out the patient's journey. That journey is identified their bottlenecks and time constraints in that journey for the patient, and then we build process improvements into that.
What we do in Emerge is we have the patient come in, they're seen by the physician, the decision to admit is made, and we receive our admission orders, and they're brought up to the floor within an hour of receiving those admission orders.
So in that time we have to make sure that the bed's ready, we have all the equipment that we need, we assign a nurse, just so we can get the patient up safely and timely.
The success of our improvements have been largely due to the measurables that each ward has that they measure. So emergency has their emergency wait times, whether they're a complex patient or non-complex, how quickly a patient is seen by a physician. Measures on the ward are throughput. They measure workload, such as how many isolation patients they have, and managers on each of these wards are then accountable to those measures to provide improvement ideas to make sure they're meeting the measure, as well as how they can improve the measure.
We look at discharge rate from the beginning, and because we're looking at discharge so quickly, actually our occupancy has decreased. Acute medicine went from a 50-bed unit now to a 45-bed unit, and we've dropped our occupancy to below 90% from 96 to 103%.
The impact for St. Thomas has been a decreased length of stay in the emergency department, resulting in St. Thomas being ranked #1 in the Pay for Results program for Ontario hospitals. It has improved the patient journey, so our patient satisfaction surveys from the patient have improved in their satisfaction in their arrival to the ward.
It is good for the hospital and the staff that work here, because we're collaborating together to facilitate the needs of the patients, to keep them happy, to provide the care they need. And I think it's just nice for all of us with Emerge and the other wards to be able to have a common goal and work together to meet that goal.